right, my name is Dr. Yodit Yaynishet. I am a radiologist currently based in Malawi. I'm working at Kamuzu University of Health Sciences, specifically at Queen Elizabeth Central Hospital as a consultant radiologist and a lecturer. So I have dual role with clinical service provision as well as training radiology residents. So as one of the only two radiologists currently available or currently on site in Malawi to train the radiology residents, the importance of the expert volunteer radiologists can be seen in two folds. So the first being that Queen Elizabeth Central Hospital is the largest hospital in Malawi, so we get a lot of cases from the remote setup as well as from the districts being referred to this tertiary hospital. So there's a significant load of cases, often complicated, that require subspecialty level of care, and that is met by this expert volunteer radiologists. And parallel to that, we're also training the first radiology residents in Malawi, which requires a lot of subspecialty training to fill the gaps in their education, so which we do through these expert radiologists. So the expert volunteers, their role translates into both the clinical decision-making of our trainees as well as their education. And this is seen through their capacity firsthand. So when they describe their findings as well as when they make decisions that impact the patient's care, we see that it has been greatly enhanced due to this program. Absolutely. So because the curriculum required to produce a general radiologist in a setup in any setup requires the residents to be exposed to as many cases as possible, to as many subspecialty training as possible, and we do not have that currently on the ground. So we rely heavily on these expert volunteers to fill the subspecialty level of care and to produce capable and competent general radiologists at the end of the program. So yes, absolutely. So the first cohort of Malawi-based radiology trainees will be graduating this year, and this is a very significant and exciting milestone because currently we only have 4 radiologists for a total of 20 million plus people in Malawi, and this is a glaring discrepancy. So with this, we are hoping by the end of this year to double the number of radiologists, and we will take in more trainees and expand this program. As well, the graduates will be involved in training more residents in the future. So as you can see, the impact it's very wide, and you can see that the impact cannot be really overstated. Yes, so I have worked in multiple low resource settings across Africa. So my research mainly focuses on diagnostic imaging modalities that are widely available yet underutilized. For example, ultrasound and X-ray machines. So one research that I've done includes utilizing in a novel way ultrasound machine to predict cardiovascular risk scores in adult patients, specifically to the African population. And we can also use ultrasound and X-ray machines in association with AI-assisted softwares and algorithms in order to enhance the diagnosis of critical cases or emergency cases, especially in the remote setup, where they can be used by non-radiology health professionals in decision-making when the patient cannot be referred easily to the tertiary setup. And the other area of research that I'm very keen on or interested in is low-field MRI, where this low-field MRI is relatively cheaper and more easy to set up or establish and can be distributed in remote setups, and also use AI-assisted algorithms to make the images up to a quality which is enough for clinical decision-making. So utilizing these machines up to the maximum can be done in such setups. We would need a lot of mentorship from expert researchers in order to train our trainees as well as the wide field of healthcare. And we'll also need, for example, one part of radiology that is underutilized is interventional radiology. So in order to build interventional capacity within Malawi, we'd need on-site help and on-site facility in order to use that for diagnostic as well as for therapeutic purposes. So facility as well as mentorship is quite critical. So imaging research matters for patient care because it directly translates to early diagnosis and avoiding delayed complications from misdiagnosis. So the more research that we put into the diagnostic radiology and imaging, the better this translates to the population and getting earlier and faster diagnostic tools that help in managing the patients quicker.